Hi Cornerstone, how are you? It's me, your doctor, Dr. Elisee, board-certified family medicine physician, CEO and co-founder of Cornerstone Medical Group. If you're watching this video, well, it's that time again for us to learn again this month. And you know how I do it. I'm giving you the most relevant information of a topic that is affecting our community and that we're seeing the most of. And this subject in particularly is literally right off the presses. It's some of the CDC updates. So what are we going to be talking about today? We're going to be talking about COVID. I know you're tired of hearing about it, but it is important because we have the newest guidelines that have just changed that's going to affect you, that's going to affect me. So today we are going to discuss what are these new guidelines, why are they in place, and how it's going to be affecting school and how it's going to affect you who is vaccinated and those of you who are not vaccinated as well too. So go ahead and grab your pen. I'm going to be looking down from time to time because I'm literally taking some of this information directly off the CDC guidelines and their online report on their website, and I want to just help you break it down to understand a little bit more. So what do we know as of what's going on right now? Right now, Florida is in the red. Florida is in the red. And what does that mean? That red means it is in the highest transmission rate. There's only one county in Florida that is not red, and that's in Glades County. If you go back to your email, you'll see that I placed a link in there for you to just click on, and it'll take you directly to what that means. So you could see that we are having the highest transmission rates. I just want to bring this in perspective for you. Right around the month of January 2021, we began to see a decline in the peaks of incidents. So incidents are the new infections that people are having with COVID-19. We began to see that decline there. And now in June and July, there's been an increase by approximately 300%, a 300% national increase in the transmission rate. And those rates are in those counties that you see on that website that are in the red. So I want us to pay attention to Broward County, the Dade County, Palm Beach County areas, but truly all of Florida. We have the highest transmissions rates. So what are the new recommendations? So the first thing, I'm gonna read it as it says. It says CDC recommends all unvaccinated persons to wear a mask in public indoor settings. And now here's what the change is. And fully vaccinated individuals, those of you like myself who are fully vaccinated, again, remember that's 2 weeks after your second dose of either Pfizer or Moderna, or 2 weeks after if you have the Johnson & Johnson, that we are considered fully vaccinated individuals to wear your mask in public settings, in public indoor settings as well. So before, where the CDC was saying those of you and those of us who are vaccinated, maybe not so much, now it's completely changing. And why has that change occurred? That change has occurred for a couple of different reasons that we'll speak about a little bit more. So let's go on with what it's saying as well too. They're also making note that there should possibly be some serial screening or testing of individuals that are in areas of high risk of exposure or severe illnesses. So who is in the high risk of exposure? This is where the school comes into play. Students, staff members, in kindergarten to grade 12, institutions, these are our colleges, our universities, healthcare workers, residents and staff of long-term care facilities, in addition to incarcerated individuals, homeless persons, and those who work in a high-density work site. These are individuals who have high-risk exposure. And what they're saying is that you should possibly be getting a serial type screening. And all that is saying is that maybe every now and then you should just get screened just because. And why is that? Because we're still seeing, even with the individuals who are fully vaccinated, they still are carrying just as much viral load, but we are not seeing them transmit it as much. When we do see the transmission, these are called the breakthrough transmissions, but they still are carrying that high viral load. So the next question is, well, why do I even get vaccinated? Again, what we are still seeing with the vaccinated individuals is that they have that viral load, they are not as symptomatic, their illness is not causing them to be hospitalized and ultimately not causing their death. So again, I know some people are still not too sure about this vaccine, but we're really beginning to see that the benefit truly does outweigh the risk. So that's some information there to help you understand that. So those of you who are in education, some of the schools that I know that Cornerstone partners with, we may need to start thinking about how we can do serial testing. Why? Asymptomatic spread still accounts for 50% of spread. So let's talk about this Delta variant a little bit more. In May, the Delta variant attributed and was considered to affect 1% of all COVID cases. So in other words, 1% of all COVID cases were the Delta variant. As of today, July 2021, just this week, it is now considered 83% of all COVID cases. And again, this illness is not following the rules, it's not reading the books, it does not present itself the way it presents and we expect it to present. Again, we're still seeing people who are asymptomatic. Some people will have a loss of taste or smell, other people will not. So what we are saying more than anything else is that this variant is running rampant. And because this variant is running rampant, CDC has now changed their guidelines and what some of the expectations should be. And the biggest change that we see, fully vaccinated individuals still keep your mask on indoors. And I would even venture to say this, because we spoke about that viral load that fully vaccinated individuals have. I would even venture to this. Even if you are in a indoor public setting where there is possibly not a high risk, I still want to encourage you to wear your mask. Why? Especially if you have an individual at home who has not been vaccinated or more vulnerable. So maybe as someone who's under the age of 12, maybe it's an individual who has a compromised immune system, an individual who's on multiple medications. These are the ones that we speak about that have multiple comorbidities, so that you'll be able to protect them as well too. Those are our biggest information here. And here's the other thing that we're seeing as well too, as we continue to understand and know that it's not just one thing that's going to help us to get control, a little bit more control of this in this pandemic. So we don't want to say it's only the vaccine that will cause us to have a little bit more control, but we do understand that it's a combination of what we know, those universal precautions of washing the hands, wearing the mask, and the vaccine. But what do we see? We did begin to see, as we had a rise in individuals getting vaccinated in January and slowly declining and going down, we began to see an inverse relationship with the number of new cases and the spread of COVID. In other words, as more people got vaccinated, we began to see less incidents or new cases and spread of the disease. Now, coming into July, as less people are getting vaccinated, the incidence and disease is going up, the number of individuals who are affected. So this is what we call an inverse relationship in science of this one thing that we're able to see that is occurring. So more than anything else, I encourage you to call me, to let me know. We can schedule an appointment, whatever you want to do to make sure that you are making an informed decision. And truly, that is what this is all about. You have to make an informed decision to make sure you're protecting yourself and your loved ones. So that's all we have for you today. I always want to keep you with the high yield. Check out that website that I put in the link for you there to get some more understanding. And again, I'm here to break down what all the scientific words are and what that they really are saying, so you can have a better understanding for yourself. Thank you so much for listening. And please, I encourage you to share this video with someone else that you know that will benefit them and are still not too sure of what's going on. Take home point, keep those masks on indoors. Bye.